Dr. Matt Connolly. I'm the podiatrist for Commonwealth Orthopedic Centers based in Northern Kentucky. Today's video concerns how a fracture or a sprain heals. Most people, once they understand it, can do a good job in helping get these things accomplished. The first thing we need to understand there is what fractures and sprains are. Many people try to differentiate between a fracture and a broken bone. There is no difference, and don't think of it that way. A fractured bone is a broken bone. It's simply a bone, the girder of our body, the thing that holds our structure up, that is broken in half. It's bending in the wrong place. It hurts. It won't hold weight. A torn ligament or a torn rope that holds those bones together is called a sprain. In both cases, when we're having trouble, you won't be able to hold your weight on a foot or ankle, and that's when we'll have to step in and do something. So the question now is, now that you've been diagnosed with this fracture or this sprain, how are we going to heal that? And the answer is we have to hold still. I don't know how to heal a broken bone. I don't know how to heal a broken ligament. I haven't any idea how to do that, but God does. It's built into the system. And what happens is if you take two pieces of bone or two pieces of ligament and you line them up and you hold them still, they simply grow together. And so my job then is to hold you still. Now sometimes it's a disaster. It's something that is so far apart or held so far away that we really need to do a lot of work to get together. We'll use pins, we'll use screws, we'll use bunches of screws in different directions, we'll use plates, we'll even put you in bed with a foot in a sling. What we're trying to do is hold you still. One of the things I say to my patients is that everybody gets better if you just go to bed for 2 months. Although it's a terrible technique, it does work. The other thing that people will say is they don't do anything with a broken toe, and there will be another video on this site that simply talks about that. But for the purposes of this lecture, broken toes many times will heal without any help because they're holding still enough to do so. So between that, the common middle ground in there is a cast or a boot, but what we're doing is putting on a large, hard, thick bandage that won't let you jiggle around. And if you don't move, these things should grow back together. How do you know it's working? Very simple. Movement will cause the body to swell and to hurt. No movement and the body doesn't swell and the body doesn't hurt. So if you pay attention to that, swelling and pain, you'll know whether you're moving these parts, especially early in the course of care. Sometimes later in the course of care, your doctor will have you go ahead and push through that. But early on, swelling and pain generally means stop doing what you're doing. And no swelling and no pain means you can keep going and we're holding this well. I'm Dr. Matt Connolly for Commonwealth Orthopedics.